Okay, the wet soil versus umbrella cell. This is what we call a compounding association. So association is the more like a relationship. In machine learning, there is some association analysis also, but actually the rain cause this is kind of small. Rain cause wet soil, and rain also cause the high umbrella cells. But we have a high correlation between wet soil and umbrella cells, right? That's what we call is a compounding association. So association means a relationship. So wet soil and umbrella cell, yeah, I can tell there is association in technical word, in the statistical word, meaning is a high correlation. But this correlation is from the one common cause. Right? This is rain. Rain is a common cause. When there's rain, rain causes wet soil, and rain causes the umbrella cells. So if we take it out this rain, it seems like a wet soil causes the umbrella cell, but that's not. So this is what we call this compounding. Potential outcome. So we will talk about how we find out is actually A cause B or not. Potential outcome is the outcome if we do something. Okay, so we usually use a 0 and 1. So there's two different notation you can use. So this is I's individual, and then if we don't do the treatment, that's what we call this control. And what would be the outcome? And this is the 0, and this is a 1 means if we do that treated outcome, I's individual, what would be the outcome? Y means it's outcome, I means it's individual, I's number of individual, and the 0 means if we don't treat, and 1 means if we treat. So here treat means it can be a medicine, we give a medicine to the patient, and 0 means we give a fake pill. So actually we are not giving them any medicine, but to avoid the placebo effect, so we give something, but actually that is not a real medicine. That's what we call this a potential outcome. What is the fundamental problem of the causal inference is that we can observe only one of the potential outcome, right? If we do, so this is an injection, we do the treatment to the sick person, maybe the person will get better, right? This is the result. We will have a one outcome result. This is the man, age is like 48 years old, and he has the kind of the disease, and then we inject some certain some medicine or treatment, and then he got better. So the treatment worked. However, we don't have a data what would happen if we don't give a shot to this patient. Would he die? Maybe, but I don't know. We cannot know because we actually treat him. So what would happen if we don't treat him? That's what we call this a counterfactual. So factual is that we have a data. We have a data and he got better. Our treatment worked. But what if we don't treat him? What would happen to him? We don't know. Right? That's what we call the counterfactual. But every single data we have, right? We don't see the both of them. We see only one of the outcome. So another case is we don't give any the medicine. We don't treat, and then he remained sick. That's a factual because we have a data. But what could happen if we give a shot to that patient? Could we be fine? I mean, get healthy, or will be still sick? I don't know because we didn't try. So this is a count factor, but all the data we have is only one side of potential outcome. This is a fundamental problem of the causal inference. So average treatment effect, we already seen the average treatment effect there, but individual treatment effect is the specific person, what would happen if we treat him, and what would happen if we don't treat him. And if you calculate the difference, that will be the individual treatment effect. Yeah, of course, we don't have both. We have only one of them, here or here. I don't know. It depends on the data, but we have only one of them. So average treatment effect is the we trying to calculate the average of this difference. Again, we don't have both of them. We have only one side data. Okay. Okay, so why this is the population level difference. So if we can calculate this one and this one, we can, again, why this is not an individual level. Population level, if you calculate this difference, that's what we call the average treatment effect, because some patients show the effect of treatment, some patient doesn't show, but if most of them has an effect of treatment, then we can tell there is an effect. On average, there is effect. So this is what we are actually trying to find out. But we don't know this one because we don't know, we have only one side of the data, so we cannot calculate it. But what we can calculate it is this one. You can just collect the data that is treated data. You collect the only data that t equals 1, and you collect the only data t equals 0, and you can calculate the expected y average. But this difference is not the causal effect because this one includes a confounding. Okay, so that's why these two are not the same. I will show you when these two things are the same. When we do the randomized control trial. Randomized control trial means we decide on the treatment for the individual completely randomly. So this is like that. So are you gonna give a shot or not? It depends on the result of the coin toss. I don't look at how old he is, how severe the situation is. You just toss the coin and then decide. Okay, you got this shot. If it's a tail, then oh no, you don't get this shot. And if you decide that way, all the characteristic of the patient who got treated and all the characteristic of the patient who didn't get a treatment will be randomly mixed up, right? Since if we do that, then there's no confounding effect. So we can tell these two things since there's no confounding effect. This is a causal effect plus confounding. But if the confounding effect is gone, then this is just simply become a causal effect. So you can tell, this calculation you can tell. So that's why we want to do the randomized control trial, if it's possible. But most of case, especially done in social science, so like biology or science project, you can control a lot of cases. But social science, we usually get the observational data, which is already happened by itself. So you cannot make it that's completely randomized control trial. Why we don't use RCT is sometimes it's a ethical reason. If you collected I want to find out how the smoking caused the lung cancer. So you collected like 100 patients, and then you just toss a coin. if it's head and then you said, okay, you smoke, and if it's coin is tail, then okay, you don't smoke. And if you divide it that way in the smoking person and non-smoking patient, and if you do the study, then you will get an exact result. You can just simply calculate the the average result this side and average result that side, and you can obviously you can see. But can we do that? Can we ask our patients? So since I tossed a coin, I got a head, so you should smoke. Yeah, we cannot do that. That's not ethical. Or some infeasible is the does the economic system affect the GDP? So you can say you can toss the coin, and then if it's head, okay, you will use capitalism, and the tail comes out, okay, you will use the communism. Can we assign the economical system randomly to the country? If we assign a whole country in the world, assign the okay, you do the capitalism, you do the communism, and randomly assign, then we can see easily which one has a higher GDP, right? Uh, but this is not ethical reason. This is we cannot do that, right? Impossibility is pretty similar to the infeasibility, but maybe someday later this can become possible. But we want to know the DNA sequence actually affect the liver cancer. If you want to do that kind of the effect, study effect, then when you some baby born, right? Maybe you have to do the when even the baby was born, then you have to change the DNA, right? And then raise the kid, and then you will see the kid will have a liver cancer or not. Um, no, it's not possible. We cannot do that. So that's why the most of the observational data, we use a lot of observational data. Observational data means you cannot control. So that's why you cannot have a randomized control trial. So when we don't have a randomized control trial, you cannot simply calculate uh, average of all the treated case and then average of all the non-treated case. If you just calculate the difference, that is not the causal effect only. It also has a compounding effect.